and Hoke, NAIOMT faculty, and I'd like to discuss the Sharp-Purser test. This is a test that has been used in patients with rheumatoid arthritis to look for instability at the atlantoaxial joint. It's also been utilized to look for dysfunction in that region in other populations. It also has two different formats in the literature. One looks at the ability of the person to flex the upper neck while you're stabilizing C2-3 and pushing through the head and atlas posteriorly. In the rheumatoid arthritic patient where the literature was originally described, they describe a sense of increased motion or occasionally a clunk as the atlas repositions back against the dens. Another variation of that has been described by Pettman that looks at what happens when you perform upper cervical flexion and produce symptoms in the extremity. If you're stabilizing C2 and put pressure through the head and atlas in a posterior direction, this should reduce and eliminate the symptoms in the extremity if the flexion of the upper cervical was caused by increased mobility at the atlantoaxial joint. So in theory, if the patient is flexing, has symptoms in the limbs, this test is actually reducing and eliminating symptoms and therefore is a safe technique to do. At no point should you begin to consider this test if there has been recent trauma in that area and significant ligamentous and or stress fractures have not been ruled out.